We'll be going over brain metastasis and the role of radiation therapy, recognizing that we're seeing a growing role of radiosurgery and a diminishing role of whole brain radiation therapy. Just brief background, approximately 200,000 patients a year in the US alone are diagnosed with brain metastasis. So that's 10 times more common than high-grade gliomas, for example. Of course, the primaries tend to be lung, breast, and melanoma. Radiosurgery has been used now for a few decades in the treatment especially of oligometastasis, and that's arbitrarily defined as 1 to 4 brain metastasis. If you have smaller brain metastasis, in other words, less than 2 centimeters, the local control is quite good. It's 90% long-term local control for these small lesions. However, because the radiosurgery is so focused, patients are at risk of developing additional brain metastasis over time. And in some studies, it can be as high as 50% at 6 months. So because of that, there's been an interest in adding whole brain radiation therapy with the radiosurgery to improve intracranial control. And the question has always been, by improving intracranial control, will we have a survival benefit, and what are the toxicities? To my knowledge, these are 3 of the studies that have looked at adding whole brain radiation therapy with radiosurgery. And you can see right away, the gold rows, that whole brain radiation therapy improves local control. In other words, the lesions treated with radiosurgery, and significantly improves control in the remainder of the brain. In other words, prevents new brain metastasis from developing. However, there's absolutely no improvement in survival with the addition of whole brain radiation therapy. So basically, we have a local therapy modality that improves local control but does not impact survival. And when you have a local control modality, the side effects are really important to determine whether how much you wish to use it and whether you wish to use it. And the question comes down to is what is worse, developing brain metastasis or the whole brain itself for cognitive function? I think the study that answers this best is N0574. Patients with 1 to 3 brain metastases were randomized to radiosurgery or radiosurgery in whole brain. And we saw no difference in overall survival. What we did see was the patients treated with whole brain radiation therapy were much more likely to have cognitive decline than those treated with radiosurgery. We also saw an impact on quality of life, and for the audience, a 10-point change is considered clinically significant. So to see a 22-point drop